Do you think that the nutrient health package or the energy package, as we call it, the nutrient testing that we do, do you think that is beneficial for children, especially from a dietitian standpoint?
I think it can be helpful. And again, there are biomarkers beyond just nutrients on that lab, but you can identify mineral deficiencies like zinc or molybdenum, magnesium on there as well. But heavy metal contamination in baby foods, baby pouches. There was a big workup or study done several years ago that showed a really high concentration of heavy metal content in a lot of popular food products, the pureed foods. And I think that's just a byproduct of things that are in the soil that when you process food and put it in there, so you can get a better idea of if there's anything that's in your or your kid's system that you might need to help clear or get rid of their lead, mercury, arsenic, cadmium, things of that nature. But yeah.
And I think it's also important to note, speaking of things you can find in their yeast markers,
yeah,
that's a big one for kids. So there's a nice little section on that nutrient package or the energy package that is a measure for yeast. But I think it's really important for parents to know that sometimes you can have, multiple things going on, malabsorption for a long period, stressors in life, frequent illnesses, and that can deplete the system. And then replacing those nutrients often is what the body, especially young bodies, need to achieve homeostasis or balance. And so then children respond really quickly, to writing the path for them overall. Speaking of heavy metal, just a side note on that nutrient test that we do, the energy package that does the vitamins, minerals, amino acids, omegas 3, 6, 9, 7. It looks at some metabolic markers of absorption, digestion, but it also has the heavy metal testing that you mentioned just a second ago. I think that's important to know because parents don't understand how much that interferes with energy production and focus for children. There's a ton of literature on IQ deficits with lead toxicity, for example, and we don't think that we're exposed to lead, but some people genetically don't clear it very well. And so for them, that low-level, regular exposure, eating the dirt, playing in the dirt, living close to somewhere where maybe an old house paint was scraped and it's now in the soil, they don't clear it. So for them, that low-level exposure increases that body burden. And so over time, it affects their behavior, it affects their IQ, it affects their day-to-day activity. So I think that's another thing that people don't think about when you look just at I'm just going to test my nutrients. Well, there's a lot more to it, obviously.
I think it goes for the parents, too, that their gas tank is empty, essentially. So,
yeah, for sure.
You can talk more about what they can expect from information gained from the nutrient or the energy package.
One of the most interesting parts of that panel is the fatty acid page, where you look at the types of fats that are in your blood. Omega-3s and omega-6s are considered essential because we can't obtain them from our own bodies. We have to get them from the food that we eat. That's why it's considered an essential nutrient. And omega-3s especially are important for brain health and development. Whether you're a mom that's expecting or breastfeeding, or even if you have kids that are now eating solid foods or you're introducing fish or seafood, omega-3 rich foods are critically important for that brain tissue development and also to help reduce inflammation. Omega-3s help to turn off or resolve inflammatory pathways in the body too. So checking that can help you identify what foods we need to bring into the diet or what we might need to increase in frequency.
And fun fact that you'll find out on that test, if you're deficient in certain nutrients, Bs, for example, vitamin C, magnesium, then you actually aren't able to properly metabolize some of those omegas. So deficiencies interfere with your absorption.
There are different types of omega-3s, and the conversion from one form to another requires nutrients to serve as a cofactor for that conversion. So we can help you interpret that. It's a little bit over most people's heads, but that's why we have the interpretation part of the lab. We don't just test it and say, here you go. Right. We sit down with you for at least a full hour and go through the report, line by line and help you understand it. So that's what I enjoy about what I do, is providing that education and understanding.
It can be overwhelming and daunting. Whether it's the gut health or energy, what are some things that we can do to help minimize confusion when we're presenting the results of the
right? So I'm
like
very adamant that my recommendations are summarized in a 1-page line item thing. Here's what we need to do in the diet. Bring this in, this in, this in, and make it very clear for the patient, so that there's no confusion. Once they leave that appointment, they know exactly what they need to do. And hopefully they can have a better understanding so they can communicate that to their loved ones at home as well. So everyone's on board.
And taking into consideration their age and development size, and
right.
Are there supplements that they can take in liquid form or chewable form or
sure.
powder?
Yeah,
like
if that's needed, if additional like omega-3 supplementation, a 3-year-old's not going to be able to swallow an omega-3 capsule, and I probably wouldn't recommend that anyway.
Yeah.
But just taking into account each person individually and tailoring the recommendations.
So that's actually key, because I know you can order a lot of these specialty tests online on your own.
Yes.
And I've had people bring them in and say, oh my gosh, this is 12 pages of confusion. Like, what did I just get myself into? So having someone with the expertise to be able to sit down, hear your history, find out what your needs are, how to meet those needs, and then dial it down to some very simple steps that could cover many bases, I think is really valuable.
Yeah, great.
So that's great. So, we've talked a little bit about moms, we've talked about kids, but what about dads? Moms and dads run the house, and if they're not healthy, kids aren't healthy, right? If they're not energetic, if they're worried about their family history of stroke or heart attack, or maybe they have preteen children and suddenly one of their their parents have a diagnosis. Now they're worried about, oh my gosh, I don't want to get a stroke, or I don't want to have a heart attack. What can we do for them, and how is that heart health package important for them? It's kind of silent. I mean, cholesterol issues and heart issues are
I think knowledge
quiet.
is key there. And again, like a lot of people, myself included, the longer I ignored it, I just thought it would, not ever present to itself. But the more I became aware of what my body was doing with cholesterol, I was able to minimize risk factors, or I am able to minimize risk factors the best that I can. So starting with baseline information, I think, is going to be the key. And again, it's more advanced testing than your typical lipid panel that you're going to get. And I hear more and more people talk about lipoproteins, or in the lipoprotein A's and B's are kind of the buzzword. Even in the conventional world, I think with social media, they're starting to key into that, but they don't really know what to do with it right now.
Right.
I've actually heard that from patients that come in and say, oh, I took that back to my cardiologist, what I think is awesome. And I think it's great that they're willing to look at it, but they literally say to them, well, there's nothing really we can do about that. Meaning there's not a prescription I can write for that. So that's where diet and lifestyle comes in.
Right.
So I think it's empowering.
Yeah, providing education on what are things in your diet that we can change to help improve your lipid panel, and also to help the patient identify, is it diet and lifestyle, or is it more a genetic pattern that you have a tendency to have high cholesterol? I've had patients that have had, the perfect diet, quote unquote, exercise regularly and still have high cholesterol. And they get really frustrated when that happens.
Well, and like I've told you, I don't mind sharing my experience. I was watching my cholesterol numbers go up and up and up, and I was changing everything that I was eating. I'm staying physically active, doing everything right, even tweaking it from certain types of oils. So I was taking olive oils and changing it to avocado oils. My numbers were still getting better. And then through running genetic testing, I realized that my body takes good and turns it to bad. So I have to just be more diligent in the prevention and realize that I'm working uphill a little bit based off of my DNA.
And this is important because unchecked cardiovascular disease that's progressing leads to more, early death from heart attack or stroke. And it's, I think, the number one killer of women. And maybe men too. I might be wrong.
Everybody.
Right, everybody. So it's if anything's going to get you, it's going to be cardiovascular disease. Odds are. So why not take the steps to identify the problem early on and and correct things sooner rather than later and prevent that from happening.
So don't you hear all the time, well, I mean, it's my genetics. My mom and dad had it. So, I mean, it is
I'm doomed.
what it is.
Fatal
Yeah.
I'm doomed.
Yeah.
It's not true. That is such an old myth. Like, we've totally disproven that. So, no.
And we're not
start
anti-medication at all. And that's the key part of a lot of what you and Jacob would recommend if needed. So we're not going to ignore or patch over that as well.
There's some really cool literature on supplements and diet and nutrients. I think the saturated fats is a big one that people don't realize. But yeah, I think there's a lot of things you can do, both lifestyle, diet, nutraceutical, and then of course prescription. And I think the complement of all of them is where it's a win.
And helping to navigate the roadmap.
Yeah.
Or a plan to
It's not typically one test and you're done either. I always tell people, realistically speaking, we will test the heart health package, give you some recommendations, and it's usually, as per standard American Heart Association guidelines, it's still lifestyle first, right? Lifestyle and diet interventions first. We'll see how that panned out, 3-4 months later. We'll make some more changes if needed, and then we just do that. And I think on average, we see people really get control and really understand what makes their body, perform optimally is usually around the fourth one, in my opinion. Would you all agree?
About a year, give or take, is
I mean, it's not
of
fast,
that repeat testing. And then once we figure out what's working, sticking with that and doing a yearly or, every couple of year check.
Exactly. It's really empowering, but it's not an overnight quick fix. It takes some effort, but it's not hard. And it does keep incrementally getting better. It's just, we got to find the right recipe.
Right.
Small steps in nutrition that make a big difference, Tim.
Yeah. So with making changes to your diet, so I have a 4-year-old and I'm expecting another one on the way. So I know what it's like to not have a lot of free time or space to plan meals or cook or prepare these elaborate things. It's just not realistic for a lot of people. Now, if you have that space in your life, that's awesome. But not everyone has that. So I often start with what can we add to your plate to make it more colorful, and you don't have to do a lot of preparation or processing of the food. It's just a lot of simple whole foods that we can bring in that are more likely to be tolerated by everyone in the family, because kids can be pretty picky, and that's in a whole nother rabbit hole you can go down. But I think I would start with what can we add to make your diet better. I'm not going to start with, get this out or change that. That's just literally what can we add, what can we bring in to make your diet a little bit healthier.
That's great. Everybody always thinks that we're always gluten-free.
Right.
Yeah. So
They'll walk in and say, don't tell me I can't eat gluten or dairy.
Exactly. It's not true. I know it's a real common issue. It actually is more common as we go, into the years since they first discovered, the celiac problem and then gluten intolerance and so forth. And it is kind of a little bit of a buzzword or a trendy thing, but no, not everybody that comes in the door needs to be gluten-free. We do testing to see if that's something we can recommend. And usually it's a temporary thing to try to calm things down, fix things, and then see if you can't reintroduce it. It's all about modification and balance, right?
Right. Yeah.
Keeping things balanced. But anyway, I had to bring that up because everybody always thinks that when they come in.
Yeah.
It says, how does Salt Health ensure families are supported with valuable information? And what's the one thing you wish every mom knew about functional medicine? Okay, here we go. One thing that I wish everybody knew about functional medicine is it is an empowering, I feel like it's an empowering gift that we give people because you become an active patient in your health care. So I think functional medicine is a deep dive into the why things work, how can we optimize it, and it's not, your diagnosis isn't the end-all be-all. It's not a doom thing. It's actually more of a positive way of looking at health and well-being.
And I think we do a good job at meeting you where you are, as far as it can be a very overwhelming wake up for us to come in and say, well, we need to optimize this and we need to change this and cut this out and bring this back in and all that. And that can definitely cause a lot of overwhelm. So I do think that we have the capability of spending time with them and trying to present the information as easily as possible. And again, just setting small goals if they are getting overwhelmed and adding, one or two things at a time, reassessing and then going to the next step. So
I think that's why the packages, the things that we are offering now are helpful in navigating those recommended changes, because you can do it piece by piece and build a picture of your health over the course of a few months rather than, coming in and all at once. You could do a big workup all at once with the specials that we have going on in January. I think that would be an awesome thing to do, but implement the changes one at a time.
Mm-hmm. Yep.
Don't feel like you have to jump in and just revamp and restructure your whole life around what you're testing here. Just make small changes and we'll help you navigate what's most important.
We're all about tailoring. So sometimes people think they know which package they want. So they think, oh, I think I need the energy package. And after we sit down with them and you talk to them, a lot of times you will be really honest with them and say, I think that's a great package, but in this case, this would probably be a better place to start. So I think
that's a good point. The appointment where we sit down and, we have that first initial meeting, we're not going over labs. We're trying to determine which of these packages are best for you.
Mm-hmm. Yeah,
Exactly.
You may need tons of nutrients, but if your digestion isn't able to absorb and metabolize, then it's probably a little too soon.
Right? Yeah, exactly. Speaking of digestion, one of the things we didn't touch on for the GI package that it tests is pancreatic enzyme production. And so that's really important. Gas, bloating, constipation, especially in children. Those are things that could be helped if we knew that they were a little pancreatic insufficient. And so we can address that.
That's been a game changer for a lot of people.
Yeah, exactly.
Can you guys share an actionable tip moms can try today to improve their family's health?
I'm going to support what Tim said. A lot of times adding in the rainbow colors, like the phytonutrients, so berries and just making sure you get a variety of color and teaching children at a really young age how important that is. So learning to love, sweet peppers and just pretending that it's important to have lots of color on your plate.
Mm-hmm.
That's a tip.
And there's been studies to show that the way that you present food to a child will increase the likelihood of them accepting or trying it. So cutting out fun shapes and bell peppers or cookie cutter, textured carrots, shaved carrots instead of just a raw, baby carrot there. They're more likely to want to pick that up and feel it and play with it. And that's the first step, is them holding the food, and feeling it in their hands. And then over time, the more they're exposed to that, they'll, be more willing to try that. So play around with texture and presentation and fun shapes. And, the kids are always going to have the chicken nuggets or the high protein food. That's usually not a big problem. But what can you add on their plate to, expose them to different colors and different fruits and vegetables?
And what can you avoid? And I'm thinking of the ultra processed foods, trying to limit that as much as possible. I know it's really hard with kids, especially who are very limited in what they're eating, but I do think that they're making better minimally processed things that can be a step in the right direction. But just getting rid of the overly processed, dangerous, inflammatory foods that are lining the shelves of our stores.
I don't think kids even teenagers need the amount of sport aids that they're drinking.
The energy
I actually think
drinks.
that is energy drinks terrible.
Yeah.
The amount of caffeine our teenagers are drinking is alarming. So I don't think they realize that hurts the kidneys every time they
liquid sugar.
Yeah, liquid sugar for sure.
drinks.
Anyway, so I think making those modifications and setting examples. I know when I was raising teenagers, I realized quickly that I could live by example more than I could have them doing, everything I wanted them to do, especially when they had jobs and cars and they were out doing their thing. So I kept living by example, kept encouraging at home. And then later, now that they're adult children, they say, hey, I really appreciate what you taught us, but back then they didn't really appreciate it that much. So anyway,
I say that a lot now because we do have the teens that are resistant to everything and the parents are kind of rolling their eyes. And I was just like, listen, if I got this information at your age, even though I may have not used it in that time, I'm going to be set up for more success than I was then as well. So take it for what it is now, but just know that it's still there for whenever you are ready to start implementing more significant changes in your personal health.
So one of the important things to note about preventive medicine, it's preventive because the earlier you start it, the better, right? So the less negative outcomes you have, if you can identify things early and correct course, it's also easier to repair the earlier you catch it. So I think it's important to remember that the sooner the better. Children, great, easy to correct things. It's super simple usually, it's straightforward. The hardest part is getting them to be compliant with the diet changes or the lifestyle changes. But if that's a family activity, it's just what it is. Like if everybody's going to start eating, more veggies, then the kids eat more veggies. So anyway, I think that's
the resiliency of kids. I think I see a lot as well is they do recover a lot faster because they don't have as many years of damage as we do as adults. So it's fun to see.
And that's why it's important for moms and parents to take care of themselves.
Yes.
So don't neglect your own health. Your kids are going to be fine, generally, hopefully. But you are not as resilient as the kids. You take a bigger hit when you get sick. It takes more time to recover. So invest in yourself and take care of yourself. And, your kids are going to be grateful for that, too, down the road.
It's a good tip for moms, especially. They tend to be the last person that gets taken care of. They'll take care of everybody else. That's important.
Yeah, absolutely.